We're going to talk to Shane Fausey now. He is the national president for the union representing the Federal Bureau of Prisons, and he is joining us live from Pennsylvania. Good morning, Shane. Thank you for being here.
Good morning. Thank you for having me.
So I know that sometimes when the infirmary doesn't have enough to treat a prisoner, they will take them outside to hospitals. How do you think this is different?
I don't think it's really different than what we've been doing for, decades now. I think it's important to highlight that offenders, even while incarcerated, are entitled to the same medical care as all the other citizens of the United States. We transit in and out of the community daily across the country, everything from small doctor's offices to major medical facilities, because we do have to extend, a level of care for them, that everybody else enjoys across the United States.
So what is the process like when you're taking a prisoner out of a prison and taking them to a civilian population area?
It's really not too different. I mean, we have security protocols in place, and I don't want to really get into security details for obvious reasons, but I mean, the United States or the taxpayer can't afford to staff all of our prisons at the same level of care that our hospitals and medical centers have. So it's important to note that we couldn't have, all the different specialties and stuff at all the different facilities. We do have some large medical facilities in the Bureau of Prisons, but they're very overpopulated as far as what our bed count can hold. And coupling that with a staffing crisis, it's really nearly impossible to extend a level of decent care to them. So that's why we partner with our community.
So MUSC in South Carolina there says it has spent more than $3 million to retrofit this wing of the hospital to make sure it is safe. Are there any concerns with the fact that it has been retrofitted and not built specifically for this purpose? Is there any potential that they might have missed something, or there might be a gap they didn't fill?
I would have to say $3 million is a pretty good cost savings to the average taxpayer. If you were to build a state-of-the-art medical facility just to for offenders, would be much more expensive than that. So again, it's a balance between security and cost savings for the taxpayer.
And is there any limit to what crimes the folks that are transported to such a hospital could have committed? Are there levels of offenses where you say, hey, this person, we're going to have to bring a doctor to you because you can't be out in the civilian population, versus somebody who you can say, well, that is a person who committed this offense, and maybe they can be taken to this hospital and led around civilians?
It's a lot easier when you have a secured wing like this, and we've done this in the Bureau of Prisons. We've partnered with larger medical centers, and we have secured wing facilities. It's so much more secure because every time you move an offender, especially your high security offenders, you risk the community just by that movement. So having them, once they arrive at a secured facility like the wing you're describing, it's a secured facility. You have the technology in place and the physical infrastructure to maintain that security. So it's much easier to keep them there while they're afforded their care versus transiting them back and forth.
All right, and they say this is going to create 60 jobs in the area as well. So hopefully it is safe, just as you say. That is Shane Fausey. He represents folks in the Federal Bureau of Prisons. Shane, thank you very much for joining us.
Thank you. Have a good day.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.